Good evening, or good afternoon, depending upon where you're watching us from. You are watching Wellness Watch right here on the African American Wellness Project, as well as on blackdoctor.org. I am Ellis Dean, your co-host as part of this program. Tonight's program is going to be a little bit different. This program is typically we bring on really, the world's top experts in a specific area of health and wellness. And we've been doing this show for about 4 or 5 months now. But this show is going to be a little bit different. Tonight, we're going to do a review. This is kind of a review of the broadcasts that we've had in the past. We're going to talk about some key points on each one of those broadcasts so you can kind of get a broad spectrum of all the things that we've talked about here and that you can share with your friends. So before we get started, what we got to do, we tell you always the things that we'd like for you to do. One is let us know where you're watching from. Put that in the comment section. We like to see where people are watching us from. Also, we would like for you to share where it is. And if you have any questions as we're discussing tonight's topics, please make sure you put them in there and we'll answer them as best we can based on the topic that you'd like to know about. Also, one last thing I'd like to say is that if there is a topic that you'd like for us to discuss, and if we can find a specialist in that particular topic, please put that in the chat room because we'd like to know, because we want to make sure that this show is answering the medical questions that you have, the health and wellness questions that you have. And if you've got a topic and we haven't talked about it, make sure you let us know and we will get to it as quickly as we can. So as you can see, Dr. Lenore has joined us. He's been eager to get on and talk to you all this evening. So welcome, Dr. Lenore.
Yeah, I'm so excited. I never do get that opening right. I always forget to change the guest, but it's simply because I'm just so excited to get here and be able to talk to people on our program, The Wellness Watch. You start today, we are going to review some of the things that we have talked about before because we may have missed a few points. Some of the things we want to talk about include health equity, prostate cancer. We're going to talk about the Black father discussion that we had. Passion fatigue, which is a term that a lot of people don't remember, maternal mortality in the African American community. And then certainly we'll kind of polish it off with something about the COVID discussions that we may not have discussed in the past. I think our first discussion really is about health equity, health literacy, and why we at the African American Wellness Project do what we do. I think you hear the term health equity thrown around a lot. And what it means is the difference between our health and their health. That's simply what it means, is that for 400 years, African Americans have not had the same level of health that the rest of America has had. And that is partially a set of circumstances, but much of it is deliberate. We have been tossed around, experimented on, uncared for, and finally we're starting now in some of the discussions that we're having with people to talk about how unfair the system has been to African Americans and how we need to catch up. The African American Wellness Project believes that you need to take on this issue of health equity by organizing your own healthcare system. We talk about that on our websites, on our Facebook pages. Everything we're about is about helping you to develop your own healthcare systems. And I think that's so critically important. There's not one of you out there who hasn't had an interaction with the healthcare system where you felt because you were Black, you were marginalized. From the staff that you see, from the doctor who talks to you, from the advice that you get from the insurance companies, I'm sure we have seen lots of examples. I think the most poignant example that we saw, I don't even know what poignant means, but the most important was a doctor, remember Alice, who was in the ICU.
Yes.
Talking about how poor her care was, even though she was a physician.
Yes.
And consequently, this is an example of what happens to all of us if we're not prepared to go into the system. And that's why we put together the African American Wellness Project.
Yeah, I think it's, we hear these terms like health equity get thrown around, and basically the layman's version is, thank you, Kim. The layman's term is basically you'd like to get the same treatment as everybody else. We're not asking for any special treatment. We're not asking for anything. We're just asking for the same treatment as everyone else. Now, what role? Some of that is what role do we play in ensuring health equities? Well, in ensuring health equity, one of the key roles that we have to play is we have to know a little bit about our own personal health and our own personal health history. And so therefore, when you go see the doctor, you go see the doctor on a regular basis, make sure you're following up and keeping your appointments. And also when you go see the doctor, make sure you have a pretty good health history. So therefore, of your family and of yourself, and you give that information to your doctor. So therefore, they can make a more robust decision. Also have a understanding of the medications that are out there. And then you can go to sites like the African American Wellness Project, you can go to sites like blackdoctor.org and find out about the medications that are available. So you just don't accept the first thing. And if the first thing that the doctor gives you is the best thing, well, that's great. But make sure you ask some questions about the medication. So I think that when we're talking about health equity, all of the burden is not on the healthcare industry. Some of that has to be on the person that's going in there, on the patient that goes in there, and they take an active role and they take charge of their personal health.
You know, one of the best descriptions of the terms that we throw around comes paradoxically from the Asthma and Allergy site. I want to go through a couple of definitions so that we're all on the same playing field. First of all, you hear health disparities thrown around, and health disparities occur when there's a difference in health outcomes between populations. My God, we know what that is. I mean, and there's certainly a difference in health outcomes for African Americans. And what is inequity? Health equity can be described as a state in which everyone has an opportunity to attain full health potential. No one is disadvantaged receiving this potential because of social position or any other socially defined circumstance. And we look at what was that? I don't know, it was Nebuchadnezzar, one of the biblical characters, said the American healthcare system has been weighed in the balance and found wanting as it relates to African Americans. We really don't have that same level of care. And what are social determinants of health? We hear that's another term thrown around. Access to quality educational and employment opportunity, physically and environmentally safe neighborhoods, ability to afford and obtain food, access to culturally competent care, and social support systems, which are crucial to health. And I think that's really been emphasized in the COVID situation. And we can talk about that when we get to COVID. But we don't want to just hang around COVID this time. We want to get to some other topics that we talked about and see if we can get into a little deeper into the bushes on those and give you a bit more information, may answer a few more questions. So let's start with the prostate cancer discussion that we had a couple of weeks ago. I think several things came up from Ellis in that discussion. One was about the PSA. When do you get a PSA at what age should you get a PSA? That was one piece of it. The other piece of it, what should you do once you get the value for the PSA? And third, what do you do and where do you go if your PSA is abnormal? I think to kind of review what I remember of that is that the PSA should really be obtained probably for most African-American men after the age of 40 if you've got a family history, after the age of 50, at least once every 2 years until you're 70. And then I believe you should continue that whole process up until you're maybe, you can't get a test anymore. I don't understand the recommendations of the American Cancer Society when they tell Black people that you don't need to get a PSA after the age of 50 because it leads to too much stuff. How can getting more information make things worse for you? It doesn't tell you what you need to do. It doesn't tell you what you have to do, but certainly a bit more information to me is just a no-brainer.
That seems to fly in the face of the data that shows that when Black men delay, and historically we have delayed getting prostate exams, that we typically when we get prostate cancer detected, it's always at a later stage because we have delayed. And so that saying don't get it at the age of 50 flies in the face, because by the time if you start having discomfort and everything like that, you might be at stage 3, 4 and later stage prostate cancer, and that diminishes your rate of survival, which we already know is lower for Black men. And so I think those are the type of things that if we know that information, so we don't look at the ACA, we go to trusted sources, African American Wellness Project, blackdoctor.org, those trusted sources that are going to give you, and here's what you have today, culturally relevant information then you can make life-saving decisions that are better for you and your family versus just going to a general organization that might be leaning towards maybe one ethnicity over the other, and you can get some bad information that could really literally cost you your life. And so I want to take a step back and just and define a couple of things. PSA, that term gets thrown out a lot when we're talking about prostate exam. That stands for prostate specific antigen. So that's something that they're looking for when they do the blood test. The other thing is they don't do the digit test anymore. So if you're a man or you're watching this show, and I know that was always a fear of men, they didn't want that digit test, and they're basically taking a couple of their fingers, putting a glove on, greasing it up, and doing a rectal, and they were touching the prostate through the rectum, through the anus, and so that can be uncomfortable. They don't do that anymore. It's particularly done through the PSA, which is a blood test. Also, what you need to know is if your PSA score is above 4, you need to be checked. You should have a PSA below 4, or your husband or your uncle or your grandfather. And as a male, you should always ask, what is my PSA? And don't let the doctor tell you it's fine. Ask them what that number is. Now, understanding that is a general rule, that PSA of 4. If you've got a family history and you're close to 4, you might want to get it checked out. If one year you were at 0, then the next year you're at 4, you might want to get that checked out because that's a rapid rise. So there's a multiple factors that come in there, but understanding as a general rule, your PSA should be below 4 to make sure that you are safe with your prostate.
Yeah, and I want to talk to. I guess this is kind of a shout out. That's an old school term, but hey,
it's still you.
So let me tell you what we talk about in the back rooms as doctors, as Black doctors. Here's what we talk about. The fact that so often we see people in an advanced stage of disease who have had a lot of symptoms and who have not come to the doctor, especially Black men. And that's true in prostate cancer, colon cancer, breast cancer, diabetes, almost every disease that we have more of. A lot of it has to do with the fact that we wait too late before we take significant symptoms and do anything. And that's particularly true in the area of prostate cancer, breast cancer, and colon cancer. We got screens for this. I mean, we know, we sit in the doctor's lounge and we say often what a pity it is that our people sometimes, and everybody, not just Black people, don't take better care of themselves, don't go get these regular checkups, mammograms, colon screens, certainly prostate cancer. And once you get a diagnosis of prostate cancer, it is not a death sentence.
No.
Once you get a diagnosis of breast cancer caught early enough, it is not a death sentence. And if you don't get screened, then that's when we sit there all the time and look at some cases and we see the same thing, that African Americans too often do not go get the screens that we need to get. And by the time we see the disease, I mean, a magician couldn't take care of it. So we're pleading for you to know the numbers that you need to know. So once you get a diagnosis of prostate cancer, go to the podcast that we did with Dr. Max Roach. He'll tell you what to do. He'll tell you what you need to do next. He'll tell you where you need to go. And what you also should remember is that you have several options.
Yes.
When you get treated with prostate cancer. And so I know many of you are listening, don't even have a prostate, but you got a grandfather, you got a father, and you got to go talk to them about getting these regular screens and get those regular screens yourself. And I think listening to that podcast will tell you all you need to know about prostate cancer.
Yeah, and that podcast was and that broadcast was phenomenal because he really kind of talked about the specific areas throughout. And it's not just the prostate itself, but it runs all the way through. And he talked about where there could be problems along that entire tract, not just specifically in the prostate. And so he did a wonderful job of explaining that, as well as understanding. You're absolutely right in terms of there are more treatment options. You do not just automatically have to have your prostate removed. Okay. And so understanding that, and if your doctor rushes to removal, say, hey, doctor, is there any other alternatives to just having the prostate removed, because there's some other complications, physical complications that can come from having your prostate removed, including incontinence and erectile dysfunction. And so if you don't want those side effects, those potential side effects, you might want to seek a second opinion before you decide to have your prostate removed.
And I haven't said this in several weeks, and I almost promised I wouldn't say it again. But if we as African Americans get as mad as someone who cuts in front of us in the Safeway line as we do with healthcare that's poor in quality and unequal, we wouldn't have this problem. Don't be afraid to go off around the healthcare system. It's not treating you right. I mean, and if you need more information about how to go off, I think everybody who knows me says I can tell you. Maybe we'll just do a podcast about that. But demand healthcare that you're entitled to. One of the last discussions we had was on asthma.
Yes.
And I want to say one thing, because that really is my area of expertise. If you are sitting at home and you're coughing and wheezing, you or your child's been in the emergency room or the hospital, something is wrong. Because we have now the capacity under proper circumstances to control almost any person who has asthma. And so consequently, if you're there and you're getting the care that you think you need, then you're in the wrong place, because we can take care of almost any person when we got the right approach, we got the right medicines, we got the right follow-up. And if you're in that situation, then I have to say it's your fault, because
there were a couple of key things that I really learned and I took away from that show that we did on asthma. One of the things is when we talked about albuterol. And I think it was a key thing, and you can correct me if I'm wrong, that if you're using your inhaler more than, twice a week or twice a day?
More than twice a week.
More than twice a week.
Yes.
Then you're on the wrong treatment plan. Okay. And so because over time that steroid could become less effective, and then we can have more complications. And so we do have to make sure that if you're using that inhaler more than twice a week, that's your limit. More than twice a week, then you might need to talk to your doctor about getting a different type of plan or running some other types of tests to find out what is a better medication for you.
Yeah, well, I'll tell you what I've done. The doctors need a lot of data. They like to get pulmonary function studies, but all I look at is the albuterol usage. I'm the only one in my office can prescribe albuterol. And if you more than one albuterol, the average person with controlled asthma needs one albuterol per year. So one every month or one every 2 months, you're in the wrong system.
Okay.
And if you're listening to us and you're still in this situation a week from now, then you haven't heard what we said. We can take care of almost any person with asthma, keeping them out of the emergency room and out of the hospital with proper management. And so I think that's the takeaway from the discussion that we had on asthma.
That was a key takeaway. The second thing that I learned really from that discussion was how much your environment, where you live, plays a role in whether it is creating an asthmatic type situation or exacerbating someone that already has asthma. And so therefore you need to take a look at your environment, including what you're ingesting, including the foods that you're eating, because that could be exacerbating, causing some inflammation, things of that nature. If you have some food allergies that you don't know about, but you like to eat it anyway, it could cause some inflammation, and that could be kind of exacerbating any type of asthmatic situation that you may have. So you've got to take not just a look at how you're breathing and dust and all those other things, but look at your environment. Where are you living? How are you living? What you're eating, do that full spectrum so you can get a better understanding of if you have asthma. So that was another key thing that I really kind of looked at, looking at the environment as well.
And if you wonder why I am so passionate about this, it's because every day in this country, 10 people die from asthma. An African-American child is 3 times more likely to die. African-American women have the highest mortality rates from asthma. And these are unnecessary statistics. These are statistics where if you've got this problem, you need to take charge. You can go to our site. You can go to blackdoctor.org. You can go to Asthma and Allergy Network and get enough information. And if you're under a provider's care and you're not any better than that, you need to change. I mean, I'm not trying to, I don't know anybody, so I don't have any problem. You need to change. One of the most heated.
There's the healthcare disparities that you're talking about in terms of that disparity. When you're talking about 3 times more likely to die from it, that's a healthcare disparity that has got to be eradicated, and it can be eradicated on both sides by the by healthcare industry itself and how they're treating Black patients, and by Black patients in terms of getting a better understanding of their healthcare situation and what they're living, and get knowledge about what you're dealing with, so you can be better equipped to go in there and ask the right questions to your doctor.
Now, one of the most heated discussions we had was around Black fatherhood.
Oh, yeah.
I think we had a guest who was, I think, very knowledgeable about Black fatherhood. I think that he had a couple children, and I think one of his statements and one of his concerns were that we're not sensitive enough and we don't listen to our children enough, and that we need to cry more in front of our children. Mr. Dean and I think, had a bit of a difference on that. And let me tell you and I didn't get a chance to defend myself as just an old school father. And for those of you who want to know what my credentials were, I was a single father of 4 girls for about 4 or 5 years. I did have quite a bit of help during that period, and I've had a whole lot of help since from my lovely wife, Denise. But in those 4 years, I learned an awful lot about fatherhood. But I wouldn't take my example of 4 children and generalize it to the rest of America. I think a couple of things. I think that parents take too much credit when their children do well. I think they too much responsibility when they don't. Stevie Wonder said it best in that song, "One child, remember, was born to learn, another child was born to burn," both raised in the same environment. And let me tell you why I differ. Because the concept of the largest society, white people, I guess, is that Black fathers are irresponsible, deadbeat, violent, and aggressive toward their children. When really, I get my bet if I said, for anybody listening to the show who had a good father who didn't fit that recommendation as a Black person, you'd have 3,000 people responding, because we have the majority of Black fathers are not that person. But that's the perception of the Black father.
No, that's the narrative. That's the narrative about the Black
narrative,
father.
The color purple, all of that demonizes us to the point where it looks to people like we're not sensitive, that we beat our children. That is absolutely not necessarily a standard, image. I think many Black fathers, most Black fathers, I don't know most, but
well, you can say most, because the studies bear that out. I've done some research on this, and research shows that Black fathers, among any other ethnic group, are more involved in their children's lives. Now, the issue becomes is just because the parents may not be married, the parents are more likely than other ethnic groups to be unmarried, but that doesn't mean that they're not a good, engaged father. Black fathers are more engaged than any other ethnic group when you control for marriage. And so if you have to be married, you don't have to be married to be engaged in your children's lives. And when I was counseling, that's what I would tell those dads, and I would tell people to this day, just because you're not married to the mother does not mean you cannot have a good, healthy relationship with your child. That is determined by you. Adult relationships should have no effect on a parent-child relationship. And so therefore, if you can separate those two and be engaged in your child's life, you will raise a healthy, well-adjusted, secure child that can go on to be a productive citizen. Now, what we also have to do is, in a macro sense, in terms of an entire ethnic group sense, is we have to protect them from accepting those narratives as their reality. And that's what we're talking about, the deadbeat dad, the welfare mom, all of these narratives that have been created by mainstream society. We have to protect them from accepting those narratives into their spirit and try to and live out a self-fulfilling prophecy to fit whatever society believes about them. You do have to protect them. That's part of your role as a parent. If you can protect your children from that and be involved and engaged in their lives, they will be the best, your wildest dream. Whatever you dream for your child, they can be that and more. But that is your role as a parent.
But here's what the crux of the matter is. We as Black parents have to have our children understand limits. Because if they don't understand limits, you get the Floyd situation, you get a situation in a lot of different places. You get, that unconscious bias that schools have toward you, that Black males, that that the healthcare system has toward Black males. And so a lot of parents really understand and feel very, very strongly that limit setting is a key piece. So let's just get to the chase. I mean, here's always the argument. Now, I grew up in a household.
Wait, what type of limits are you talking about?
Well, we're getting ready to talk about that.
Okay, all right.
We're talking about how you set limits really has changed over the last several decades. I don't know that I need to cry in front of my children. I don't put my hands on them, but that wasn't my mother's problem. My mother's problem was not putting her hands on us. And I think that part of it was because we were a little rugged, around the don't do stuff. But at the same time, I mean, I think she felt that if we didn't have structure and we didn't have, discipline, that we were that we were threatened by the society. And I think nowadays, I think most of the people of my generation were probably disciplined in a very different way. I mean, we were whipped. I mean, we weren't beaten like most people think or talk about, but we were certainly disciplined. What do they call that kind of discipline? I've even forgotten because it's so.
It's called corporal. We're talking about the physical, corporal punishment.
Yes. Yeah, we were corporally punished, and I say with a capital C. I don't think that necessarily resulted in a successful parenting model, but certainly that was what we used, and I wouldn't recommend that, certainly now. But I don't think that because we are old school that we are not sensitive enough with our children, and I object to the image that the society has of us, and sometimes we perpetuate ourselves, that Black fathers are of that image that we are portrayed as. And I think we need to do everything we can to tell good stories. I often tell people that, I mean, I'm interested in talking to your audience and my audience about issues. But, I can tell you that in the Bay Area and around the country, I'm the only one talking to Black people about health. And I always say that if we were to rob a 7-Eleven store and on the way to jail, we could talk about hypertension, diabetes, somebody would cover us because we robbed something. So the image that we have as fathers is perpetuated by the media and not always the way it is.
Yeah, I think ultimately that's where I'm with you in terms of protecting our children. And part of that protection for me, and this is my opinion, so I'm going to speak just for Ellis Dean, is teaching our children our history, right? And I think ultimately because they don't get it in the school system, and all you do is a quick Google search on critical race theory. You can do a quick Google search on the 1619 Project. There's a number of ways, and there's a number, and mainstream America, white America, is pushing back strongly against the teaching of those things. And it's like, but those items, those two items and others, in terms of learning a robust history of African Americans in this country and the contributions, the real contributions that we have made to this society, not only gives us a sense of self, it gives us a sense of history and of our ethnicity, and you don't get like those crazy things that Black people we haven't done anything. We have done plenty in this country, more than you know, because they've done a masterful job of taking it out of the history books. And so when you don't learn about it, you can't trust the mainstream society to teach us about our history. We have to do that as Black parents. We have to do that as Black people, teach our children our history, and that'll give them the healthier self-esteem to where they don't go out and start robbing. They don't go out there and start using drugs and things of that nature. They don't believe they're not going to amount to anything because they know that they're standing on the backs and shoulders of giants. And so therefore you can teach about science. Did y'all know that a Black woman created the first home security system? And it was a nurse that did it. And so, but when you think of it, oh, she did what? Yes, her husband traveled and she wanted to feel safe in her own home. And so she developed a home security system. And that was the model that was used that are now everybody's got a home security system. It was a Black female that did that. And there's countless stories like that in history. We've got to tell those stories to our children so they understand that Black people are here and we built this country.
One of the things I would like to convey to parents as a pediatrician is that, when a child becomes an adult and you don't consider that child a successful adult, don't blame yourself for this. There are all kinds of influences on children. All you can do as a parent is the best you know to do. And once you've done that and you look at your family, you'll see some success stories and some not so successful. Do not blame yourself for the kinds of things that happen with your children all the time. Because once they leave that house, there are so many other influences on your children that sometimes the message doesn't get through. So take a deep breath around children that you don't think are successful as you want. Don't blame yourself. Don't think back on what may or may not have happened. It's very unpredictable at certain times. And children, like I say, in the same family can have different outcomes for a variety of different reasons. And I want to free parents from blaming
seek help
everything.
Seek help. Like if you need some help, and sometimes, yes, sometimes help is unaffordable. Thank you, Kim, for your contribution. So you've been great. So thank you so much for that, Kim. I think sometimes we try to rely too much of our own personal internal resources in order to raise our children. We've gone away, and that's one of the things I'm sure Dr. Lenore has a different experience. My mother would talk about her experience where everybody on her block growing up knew all the kids, and everybody on their block participated in rearing the kids in the neighborhood to keep them on the straight and narrow. And so it was a neighborhood, everybody leaned in. Now it's, you can't talk to anybody's kids any kind of way. You got to do this, you got to do that. And so therefore there has become more individualized, and therefore there's not as much protection in the neighborhoods. And so we've got to make sure that we've got to seek help when we can. And some of that help is just advice. Talk to a friend, talk to a family member, get some of that frustration out. It lowers your stress level. You can get some really good sound advice. Talk to your pediatrician. If you don't have a psychologist, talk to your pediatrician, and even they can at least give you some ways to help in dealing with your children if you're having a difficult time.
And don't forget your pastor. One of the other things that surprised me in terms of the interest in our audience was on compassion fatigue. I don't even knew what compassion fatigue was, but we did a program on compassion fatigue, which talked about those of you who are caretakers professionally for other people in health, caretakers for your parents, caretakers for in any capacity, surviving compassion fatigue. And compassion fatigue means that you get messed up too. Mm-hmm. I mean, you have to take all that burden, and you have to listen to all those people, and you have to take low in the family, because you have to take care of an aging parent, or if you're working in a nursing home, or if you're a nurse in an ICU, you get fatigue, mental fatigue, as well as physical fatigue, and it needs to be dealt with. Too many of us are out there giving ourselves of ourselves, and then not taking care of ourselves personally. And I thought that was one of our more powerful programs. I just really thought much about that as a part of the dynamic of mental health for health professionals and for caregivers.
Yeah, I think, as you can see, I bought the book after the show, and that was really spontaneous because, and it was right on time for me. I can be a little transparent here. I was having a rough week, and when we did that show, it really helped alleviate some of the stress and the burden that I've been feeling, because we were in the midst of in all of our COVID broadcasts, and I was instrumental in developing some of those broadcast programs, and I would see the comments and people were pushing back, and I'm really just trying to help people. We're all just really trying to help people and doing some things, and then you get that pushback, and I wasn't being able to be 100% available, not only to my job, but to my wife and to my children. And I realized that, that burden that sometimes people that work in helping professions feel from time to time. And you've got to find a way. You got to find an outlet to release it. You've got to recognize when you're overwhelmed, you're feeling overwhelmed, you're feeling stressed, and you've got to have effective and healthy coping mechanisms, because alcohol is not a healthy coping mechanism, but you got to find a healthy coping mechanisms to be able to alleviate some of that stress, so you can be 100% for all of the people that you want to continue to help.
Yeah, no question. I mean, I think once I thought about it, I said, probably that's me in some form or fashion. As a physician, you're always out there dealing with a particular case or particular problems, and you have a certain amount of empathy, and at some point you become, a little bit desensitized to the process, and it's a protection mechanism. I'm sure. As a doctor, I mean, you feel for so many people because of the circumstances that they're in,
Yeah.
and it hardens you a little bit, and sometimes you don't even recognize it. I think I was surprised by how many people called in. I think those of us taking care, well, who had the experience of taking care of aging parents, are probably the most vulnerable.
Yeah.
Because we're not professionals. As our parents age, they become a little bit crusty. They become a little bit protective, and you become a part of the problem instead of a part of the solution. And so I do think that that passion fatigue was one of the more interesting things that we talked about. Another issue that we talked about was this whole issue of Black women dying in prenatally.
Yes.
The increase in the number of Black women who were having babies who are dying before, during the prenatal period or during the delivery period. It's something that's alarmed the whole obstetric and gynecology community. And one of the things that we're concerned about as much as anything else is something called unconscious bias. You want to explain what that is, Mr. Dean?
Sure. Unconscious bias it develops when, again, you are acting in ways that you believe. You walk into a situation and you already have made some predeterminants about a particular person, situation, scenario, and that it's unconscious. You in your mind you think, oh, I'm. If you're a doctor, in your mind you're like, oh, I'm treating this person as I would treat any patient. But then when you look at all the numbers, you realize, okay, unconscious bias is really what's driving what we're doing. It makes you make prejudicial decisions about their what medications they get. It makes you make prejudicial decisions about their level of pain. There was a study done that said that many doctors, majority doctors, white doctors, believe that Black women didn't experience pain like white women. And so therefore they would prescribe, on average, they would prescribe lower acting, less effective pain medications to Black women that they would to white women because they felt like Black women could endure and didn't feel pain at the same level. That can be traced all the way back to the father of gynecology when he was conducting those experiments on slaves without anesthesia. And that has led itself all the way to present day, and it's still being carried out. That's part of that unconscious bias in terms of pain management. Is just one example that happens. So when Black women do present, they say, oh, I've got a pain, and they say, what's your pain level? You hear that from your doctors many times. They may say 8 or 9. The doctor unconsciously says, maybe about a 4. So they'll prescribe maybe a prescription strength of an anti-inflammatory when they could be using an opioid to help alleviate some of the pain. And those are just so unconscious bias drives a lot of our decisions that we make in life. And if we don't understand where our bias is coming from, where our bias lies, it will continue to cloud and affect our decisions in a negative way.
Well, I think the big thing is that we see a lot of unconscious bias on the part of the healthcare system toward Black people. I think doctors have a preconceived notion in many instances about Black people, not only about who they are, but what they are. I think in our trainings, we're really always showing, poor Black people in the healthcare system. And I think that sticks with other doctors. And when you come in, you're just another brother. I mean, if you think it's different because you have a briefcase and an executive position, that the healthcare system looks at you any differently. I got to think. It's another thing. I've heard them in the doctor's lounge. Believe me, they don't see you any differently. And for Black males, it affects outcomes because regardless of socioeconomic status, the health of Black males is worse than the health of any other segment in the population. And so if you believe, you walk in there and they refer somebody by Mrs. So-and-so and refer to you by your first name, that's a sign right there. To me, that's a sign. Or if you go in and you ask the doctor and he gets all defensive because you are organized to ask about your medicines and side effects and stuff like that, that's going to happen to everybody listening here. I can guarantee you. I mean, you may be in a nice little system right now, but before your life is over, you're going to appreciate what I'm telling you. Is that the system does not look at you the same way it looks at other people. And unconscious bias is they don't mean to do it. It's not deliberate. It just kind of happens naturally. And and the tragedy is that it affects outcomes. It affects the kind of medicine you get. It affects the kind of surgery you get. Not that I'm advocating that. It affects the kind of advice that you get. And so if you're not looking for that, then you're making a mistake.
And I could add one more bias to unconscious bias. What unconscious bias lends itself to what's called confirmation bias. And so what happens is this: unconscious bias causes that doctor to treat that Black patient differently. That Black patient now becomes turned off by that doctor, doesn't follow up because they don't feel comfortable, they don't feel heard, they don't feel they trust that doctor, so they don't come back for their follow-up appointment. Now that doctor goes, see, Black people don't follow up with their appointments, they don't care about their health, and that reinforces the bias that he walked into the room with. It's confirming the bias that he already had. So that's confirmation bias. When they basically created that outcome, it confirms their bias. And so that's how the cycle continues. So we've got to eliminate the point is we've got to eliminate unconscious bias so we don't get to that more dangerous, which is known as confirmation bias. And that's how they use all that stats and data to justify their behaviors. One quick thing, what I put in there was a YouTube link into the comment section. It's a YouTube link of an interview that I did with Kim Keck, who is the CEO of Blue Cross Blue Shield Association, which is the largest insurance provider in the country. What they have decided is they looked at that maternal mortality rate that we did our show on. They looked at the maternal mortality rate, and they have decided that over the next 5 years, they are determined to lower that gap between white women mortality rate and black and brown women's mortality rate by 50%. And they're going to dedicate time, talent, and resources like you get in church. I need you to put your time, talent, and resources. That's what BCBA is going to be doing. BCBSA is going to be doing over the next 5 years. And so that's the interview that I did with Kim Keck announcing that initiative that they're undertaking.
All right, we're going to switch now to talk a few minutes about the COVID coronavirus infection. I mean, we have to say a few things about it, but I like this. So I'm going to start with this.
I understand the hesitancy and the resistance that some folk may have to taking the COVID-19 vaccine. And you absolutely have a right to feel hesitant. The COVID is real, and I know from firsthand experience. I had it. I wouldn't wish COVID on anyone. I've fully recovered, but I don't want to ever be that sick again. You and all the people that you love are at risk from COVID-19 infection. So please get vaccinated for yourselves, your family, and your community. Thank you.
That was Actor Delroy Lindo. I think most of you, are familiar with him. And I think the only thing I want to say today, and I'm not, like I say, promise you not a dialogue on the COVID, is that 99.5% of the people who die today with COVID infection are the unvaccinated.
Yes.
So that's all. I mean, I don't have anything else to say about that.
I will say that, over the past several weeks, I don't know, some of you may have already seen some of the programming we've done. Dr. Lenore has appeared on a couple of programs. We did a 10-part series on it's called Community Immunity, and we were talking about the vaccination rates, particularly of African Americans in the states that had the lower vaccination acceptance rates. And we just kind of talked to doctors as well as people from the community, local citizens in the communities, to really kind of talk about what the attitudes, what are the barriers to getting more Black and brown acceptance of the vaccines. And so we really got some really keen insights to the behaviors, the thoughts, the attitudes, impressions. Some of the assumptions that we made were erroneous in terms of talking about vaccine hesitancy for Black people. Some of it could just be, as we talked about earlier in this program, just the social determinants of health. And some people are making a determination, if the state didn't have a good infrastructure, if they were not putting making vaccines available, in, around, or near neighborhoods that Black people lived in or could get to. If you have rural communities that people have to drive a significant amount of distance to go get vaccinated, and they have to make the decision to go to work or go get vaccinated, they're making that decision to go to work 9.5 out of 10 times. And so therefore, it's not just as simple as saying that Blacks are overall vaccine hesitant. We have to look at some significant other areas that played a role in determining whether or not somebody did or didn't get vaccinated. And so it really did provide some good, keen insights. The other thing I would say is this. Yes, I said it last night on the program, and I will say it, again, it is not 100% that that the vaccine fully protects you. No vaccine is 100% effective in terms of preventing death. However, as Dr. Lenore stated, 99.5%
in the morgue right now.
People that are dying are the unvaccinated. And so I would say this, you could either be, you got a decision to make. And so that decision is not only just for yourself, because if you're younger and healthy, yes, you're more likely to survive. But while you're surviving, you could have passed that to several other people, and you could be asymptomatic, passing that on to people that cannot survive. And so therefore, you can't just think about it in isolation as yourself. You have to think about the people that you live with. You have to think about the community and the people that you come in contact with that could have a more deadly outcome if you spread the virus to them.
And I'm going to read you the states with the lowest vaccination rates. So if you're living in one of these states, you're living on borrowed time. Mississippi, number 1, Georgia, number 2, New Jersey, number 3, Texas, number 4, Wyoming, number 5, Nevada, number 6. Those of you thinking about going to Las Vegas, come on, Alaska, number 7, South Carolina, number 8, Hawaii, number 9, and Arizona, number 10. Those have the lowest rates. The highest rates are in Massachusetts, Vermont, New Hampshire, North Dakota, Rhode Island, Maryland, Washington, Iowa, Nebraska, and Oregon. And what's key about those 10 states, they don't have very high, they're not up there in the percentage of Black population. So if you live in the states that I read off, here again, everybody's talking about the Delta virus. There's a new virus called the Lambda virus in the Philippines. And it's in the Philippines. So there's going to be some variants around, but I don't want to take any more time. I want to say a little bit about what we're going to do. And sorry, we don't have more time to discuss some of the things. And periodically, we're going to stop and do this kind of program. But in the next few weeks, we're going to be talking next week, I think, about erectile dysfunction.
Ooh.
The erectile dysfunction. That's, what can I say? In the following weeks, we're going to have the foot doctor on in a couple of weeks. What you do with corns and bunions and, plantar fasciitis and ankle injuries. That's in the next couple of weeks. And 1 week we'll be broadcasting from the National Medical Association Convention, talking about some of the latest things in African American health.
And we also have a show coming up right before school gets back. We're going to have a pediatrician on to talk about how to get your child ready for school, particularly if they're under the age of 12, because as of right now, they cannot get vaccinated. And so there's some things that you need to do to protect your children, particularly from these variants that are out there that our children are catching. And so we're going to really kind of talk about everything. We're not just going to talk about the vaccine, but we're going to talk about everything you can do to get your child healthy and safe for the upcoming school year, because like it or not, the country is opening back up, and there are going to be full classrooms coming this fall, and you need to get that information to keep your child safe. And so we'll have a pediatrician on to talk about that.
Well, you have a pediatrician on now. What other pediatrician you gonna have on?
You'll like this one though. This is the.
Are you gonna get another?
Dr. Samantha Brown. She's very good.
You're gonna get another pediatrician.
Another pediatrician. That's right.
Did you forget I was a pediatrician?
No, you focus so much on asthma and allergies that I forget that the pediatrician.
Oh, okay. All right. Well, I just have to take it as it comes. and leave it
You're
with.
so knowledgeable on all these other subjects. I seriously do forget that you're a pediatrician.
Well, I just have to take it where I found it and leave it where it is. But what I want to do is to thank everybody for taking the time to join us on today's edition
Yes.
of Wellness Watch. I think we covered a fair number of subjects. If you have friends who have been engaged, and are engaged in any things we've talked about, tell them to listen to the rerun of the Wellness Watch. When is that rerun coming on?
It's coming on Friday. Friday around noon.
All right. So thank you for joining us, and remember that health is your biggest asset. Thank you, Mr. Dean. We'll talk again next week.